Welcome to the podcast. The Aging Queen. Welcome to the podcast. Welcome to the podcast. And welcome back to the Aging Queen podcast, another wonderful episode. Today we have a special guest. We have Dr. Kristen. She's a doctor in the Navy and one of my longtime friends. I've known her over 25 years now, I think. Hello, Kristen.
Hi, Lewis.
How are you? Welcome to the show.
Thank you. I'm super happy to be here.
No, thank you. I think um, you bring such quality to this episode because not only are you a very learned person, but you're also a doctor. And today's episode is on PrEP. I wanted to ask you some questions. First thing, what is PrEP?
So PrEP is a pill that you take once a day
Mm-hmm.
to prevent getting HIV. It's kind of like birth control.
Okay.
It's a medicine you take every day to prevent getting pregnant, but in this case, it's to prevent getting HIV. If you take the medicine every day like you're supposed to, it can actually reduce the risk of you getting HIV by greater than 99%.
This has been a game changer with HIV.
Yeah, it really has. It really, really has, both in the MSM community, but
Mm-hmm.
also in the heterosexual community among couples where, let's say, the man has HIV and the woman doesn't, but they want to have a baby, and so
Mm-hmm.
you can't use a condom if you're trying to conceive, and so PrEP has allowed couples where one person has HIV and the other doesn't to actually conceive a baby safely. So it
Wow.
has been a game changer for a lot of people.
Do you have any statistics on the rates maybe that have gone down because of it, the HIV rates?
Yeah, I do. The CDC estimated that as of 2019, about 1.2 million people in the US have HIV.
Mm-hmm.
1.2 million. And of those, actually, 63% are gay or bisexual men.
Mm-hmm.
So more than half of the people who have HIV in the United States are gay or bisexual men.
Mm-hmm.
But fortunately, the rates decline every year and continue to decline by about 13%. Um, so
That's great.
over the past 5 years, uh, the number of HIV infections in the United States have declined 13%. So that's really great. It's hard to say how much of that is due to PrEP
Right.
and how much of that is just due to lifestyle changes or people using condoms, or it's hard to say, but it all contributes.
Now, what about having lived in Europe and now in the US again, I feel like a lot of my gay friends in Europe do not use PrEP, and I feel like almost everyone here in the US is on it. Um, why the cultural differences when it comes down to this? What are we pushing it more in the U.S. or is it just more accessible? Do you know anything about where in the world they use this more? Is this just an American thing?
Yeah, no, that's a great question. So it's available worldwide. It's actually used the most in Africa. They have the most
Oh
amount of
wow.
people on PrEP because they have the highest rates of HIV transmission.
Hmm.
So it's available in multiple countries throughout the world, but it is heavily utilized. Like of the developed countries, it's most heavily utilized in the United States. In 2000 and in the year 2022, there were about 300,000 people in the US on PrEP compared to 86,000 people in England
Mm.
on PrEP and only 13,000 people in Spain on PrEP.
Yeah, it's very little in Europe. Very little.
Yeah. So, I mean, if you think about in the same year, 300,000 people initiated PrEP in the
Hmm.
US
Right.
and 13,000 initiated PrEP in Spain. It's
Wow.
it's like staggeringly different.
Yeah.
And I was trying to do a little bit of research today to see why that is.
Hmm.
I'm a doctor in the United States, so I'm not that familiar with Spain and the healthcare in Spain. But it seemed to be access was the biggest thing that I saw,
Mhm.
that in Spain, you have to go to, like, a private like a hospital pharmacy to
Right.
get PrEP,
Yeah, because they have a
whereas
national healthcare system there.
yeah, so you have to go to, like, an actual hospital to get it, whereas in the United States, um, we have, like, any primary care provider can prescribe it to you.
Right.
It's and, like, and we learn about it in med school, and and we have lectures on it, and we learn how to prescribe it, and it's just become part of our daily practice,
Mhm.
so now I'm in the habit of, if I have a patient who is a gay or a bisexual man, I just instinctively offer them PrEP,
Right.
you know and so it's just part of it's like you meet someone who's overweight and you immediately offer to test their lipids, their cholesterol, and check their heart rate. Like, it's just ingrained in our practice models. So I think that's why so many people in the US started, because we suggest it. The doctors suggest
Right.
it all the time.
Yeah. And I think the advertising here is quite prevalent and legal to advertise to the consumer, where in Europe,
Mm.
it's generally illegal, and they don't.
Oh, that's a great point. I didn't think about that. You're right.
Yeah.
I'm sure, like, you have more people here asking their doctors about it. That's a great point.
Yeah. Yeah. Um, I also have noticed, statistically that because of the use of PrEP, a lot of people have stopped using condoms, for instance. I'm just reading here the national NIH put out a little article where it says PrEP was associated with a 24% increase in the rate of STIs and a 59% increase in the risk of rectal STIs. Um, there was some news, in California a little whiles back that there's basically a raging syphilis epidemic going on right now, and it's not just in the community; it's kind of everywhere. Do you think that people feel there's a false sense of that there is a false sense of security when taking this, that they feel it protects them against the other stuff, or the other stuff is just not as important as HIV?
I think the answer is twofold. I
Mhm.
think that because people are on PrEP, they are less likely to use condoms,
Right.
which is what prevents against the other STDs. So yes, I think certainly a part of it. They feel protected, and they don't want to use a condom.
Right.
That's why they start PrEP in the first place.
Yeah.
So yeah, they're more likely to get a sexually transmitted disease. However, the second part of this is that if you're on PrEP, you have to come back to the doctor every 3 months
That's right.
to get more PrEP medicine. And so at those 3-month checkpoints, we test you for STDs.
Mhm.
We do like a rectal swab,
Oh,
we
that's good.
do like a throat swab, because you can have chlamydia and gonorrhea in your throat. You can have chlamydia and gonorrhea in your rectum. You can have cancer, the same kind of cancer that women get in their cervix, you can get in your rectum. So we can do a pap smear of the rectum. And we test your urine for chlamydia and gonorrhea of the penis. And we do some or all of that every 3 months when you come back for more of your medicine. And so we're just catching these infections more frequently because we're
Yeah.
testing more.
Mm,
It's kind of like the COVID model with Trump. Like, if you don't test, you won't see it. But because
right.
PrEP encourages testing, these people who may have had these diseases in their rectum or in their pharynx, in their throat for years, only find out because they are now on PrEP and they're getting tested for it. So, that's also why the number appears to have gone up.
Right.
But these people probably had these for years and were getting infected even off of PrEP, but they just weren't getting tested for them every 3 months.
I mean, it's you're more safe if you take PrEP and wear a condom.
Hmm. Yes, you are. Yeah, absolutely. Um, the other STDs, like syphilis, gonorrhea, chlamydia, they're all bacterial, and
Mhm.
so you can take an antibiotic
Right.
and be cured of it. Some of them have longer term ramifications, like syphilis, if you let it go untreated for years and years. But for the most part, those are um, pretty easily caught and treated. Whereas HIV is obviously much more serious. So people tend to prioritize um, safeguarding against HIV
Hmm.
and sort of deprioritize safeguarding against the others if they're on PrEP
Now,
and not using a condom, basically.
exactly. I think it's great. I personally think any tool to fight HIV is fantastic, especially in developing nations, like the continent of Africa, um, and in the gay community. I just read some articles how there's still ongoing lawsuits against the makers of PrEP, basically, or Truvada. Do you know anything about this? How the first generation of drugs as compared to what's being um, prescribed now? How it's different? Do you know anything about?
Um, yeah, Gilead is the producer of
Mhm,
PrEP. That's the pharmaceutical company that made it and distributes it. And so there's kind of the old formula for PrEP, and then
yeah.
there's the new formula for PrEP. The old formula is called Truvada,
Mhm,
and the new formula is called Descovy.
mhm,
And they're very similar. In fact, like they both are two medicines in one pill,
mhm,
and one medicine is exactly the same between the two of them. That didn't change in the later generation. The other medicine is called tenofovir. That's also in both formulations, but it's a different
mm,
version of its chemical
right,
compound.
right,
So in short, it's a very small difference
right.
between the two generations of PrEP. Um, same ingredients, but one of them simply has a slightly different chemical compound in the older one versus the newer one.
Mhm,
And the reason they did that is that the older version, the original version, had two kind of negative, um,
results.
like
Mm,
yeah, it's like sort of two negative um, side effects, we can say.
mhm,
One is that it decreased it can decrease your bone density,
mm,
um,
that's not
which
great.
it's not great, but as soon as you stop taking PrEP, your bone density recovers. So it's a temporary loss in bone
Yeah, but these
density.
pills are people are taking them now forever. I mean, it's something they've incorporated into their daily routine, it's not just, antibiotics for 10 days kind of a situation, right?
Well, that's a great point that you bring up because PrEP is actually a medicine that is intended to be started and stopped, just like birth control.
Interesting.
So women are not on birth control for their whole lives. They're on birth
Right,
control when they're in a relationship, like when they're in a relationship and they're sexually active, they'll start taking birth control. But then if they break up with their boyfriend or if they're not sexually active, then they'll stop taking birth control.
right,
And PrEP is designed to be taken in the same way. It's designed to be started and stopped as you need it. If you are dating and you are having sex with multiple partners and you want to be on it, then you're on it. But if you find someone and now you're monogamous, or if you decide that that you want to start using condoms, then you can go off of PrEP. Like you don't have to be on it.
I think a lot of gay guys stay on it forever. Even if you are in a relationship, there is still, um, a lot of open relationships or
So it's like so it's their choice.
yeah,
It's their choice if they want to stay on it forever. It's and every there's no wrong choice,
right.
but it can be stopped and started. One of
It's
the
not made to be taken every day for the rest of your life, basically.
Yeah,
Okay.
yeah, exactly. It doesn't, you don't have to. Like
Yeah,
if you get to a point in your life where you are no longer having unsafe sex,
right.
then you can stop taking it. Another way that PrEP is actually can be utilized is it's kind of it's sort of like it's called event driven PrEP, but you can take if like let's say that you're not taking it every day, but you know that every Friday night you go out, or like let's say that you're going on vacation and you know that for 2 weeks you're going to have a lot of sex with with random people.
Mhm.
So you can take 2 pills
Mhm.
before, like, both you can take 2 pills at the same time, and then the day that you have sex, you take 1 pill, that like, the next day, you would take 1 pill, and then the day after that, you would take 1 pill. And then that
Mhm.
would protect you from that sexual encounter. That
Mhm.
adequately protects you. 2 pills before, the day before, 1 pill the day up, 1 pill the day after, adequately protects you from HIV from that one sexual encounter. So,
Mhm.
if you don't wanna be on it every day, but you know that tonight is when I'm gonna go to the bar, I might come home, I might have sex tonight, I'm gonna take 2 pills of Truvada, like, on Thursday to prepare for Friday. Like, you can do it that way if you
Wow,
want to.
and it's that effective that quick.
Yeah, you only need, yep, for the in the rectum, it builds up in the rectum very quickly. It takes longer to build up in the vagina, so
Mhm.
that plan doesn't work well for women. But for men who are having rectal sex, that works fine. You can take 2 the day before, 1 the day of, and then 1 the day after, and that's it.
I mean, this seems like a miracle drug. I'm looking at the Forbes article on the old drug, the old version, Truvada lawsuit. There's a 2024 update, written by Jamie Pfeiffer, on August 26th of this year. And she states in her article that the known risks of Truvada, the plaintiffs in the Truvada lawsuits claim that Gilead knew or should have known that Truvada and its active ingredients, TDF, were highly toxic in the doses prescribed and risked permanent and possibly fatal damage to the kidneys and bones.
Mhm.
Numerous studies have shown that TDF drugs like Gilead and Truvada are highly toxic to kidneys and bones and can cause permanent kidney failure and bone fractures. So they're basically saying that they knew, this is alleged, right? These lawsuits are still ongoing. Allegedly, they knew of the risks.
So yeah, so sorry, I never finished because I got sidetracked
Sure.
with
Hmm.
with how you can stop and start PrEP. But yeah, so the original medicine Truvada has 2 side effects: the bone density that we talked about, and that bone density loss is only while you're on PrEP. And then
Hmm.
if you stop taking PrEP, that bone density returns, like, it goes back to normal.
Hmm.
But if you take PrEP for your whole life, or if you're on it for years, then your bone density will decrease over that
Hmm.
time period, and you are at a higher risk for getting a fracture of your bone because your bone
Right.
isn't as strong, like fracturing your hip, fracturing your leg, whatever. So there is that risk of bone density loss. The other risk is kidney problems.
Hmm.
That's the other thing that the lawsuit brought up. That's the other known side effect of Truvada. You that it can affect your kidney.
Hmm.
And Gilead, the company that makes Truvada, has always known this and always
Hmm.
reported it as a side effect. And
Right.
so, as part of starting a new person on PrEP,
Hmm.
one of the things we have to measure is how well their kidney functions. We have to get a
Yeah.
kidney function blood test.
I think the
And
lawsuit
then
alleges that they deliberately misled patients. I mean, this is alleged, of course, ongoing lawsuit, but and in misleading patients, they also misled. I I imagine doctors because
I don't
um.
know. I don't know about that. I mean, when I learned about it back in, I
Mhm.
guess, 2016 is when I first started learning about PrEP in med school.
Right.
These risks, these side effects were um were like public, like it's on the packaging insert for Truvada, like, as a caution. And it's avail like, we as doctors, we are taught these side effects,
Mhm.
right? Like, when you learn how to prescribe PrEP, you're taught that if someone has poor kidney function, you cannot start them on Truvada, or you have to start them on a lower dose.
So
um
I think this will clarify things. In the article, it continues by saying even before Gilead released its first generation, the old TDF drugs to the public, its research division had already developed alternative compounds that were more effective and much safer. These new drugs
mm,
use can't say the word, but it's TAF, which is more effective at stopping HIV replication and much less toxic to the bones and kidneys. Plaintiffs claimed that Gilead deliberately withheld it to maximize profits from its TDF drugs instead of patenting the new formulation and rushing it to the market. So, and it led to
Oh, I see.
that they already knew that they just it's a business thing. They already knew that they had a better product there. They were still serving the old stuff. Um, and in 2018, the AIDS Health Foundation, the largest global AIDS organization, helped to file one of the first class action lawsuits in California state court on behalf of plaintiffs who purchased Truvada and other TDF drugs. The suit claimed Gilead minimized the drug's known dangers and misled patients and medical providers. Since then, more than 26,000 plaintiffs have filed Truvada lawsuits in state federal courts nationwide. So,
That's very interesting. Yeah.
this goes down to the big pharma conversation and big business and um who I feel the reason why Europeans haven't started taking it is because there's a tendency in Europe. Here I feel from everything that I've read and know basically is you have to medically do all the tests yourselves. The government isn't going to really test it for you, right? And you come out with some kind of report or analysis on the safety of it. Where in Europe, the government actually tests it, and they have to prove that it's safe enough in the long term. So they're still waiting to see, from my opinion, from everything I see, how safe it's going to be in the long term. Um, So, how long has this drug been on the market? The new one and the old one, and are there any statistics, or have you seen any patients that have less kidney and bone issues with it, or less side effects in general?
Yeah, the side effects are that I've seen are very minimal. The two long-term side effects are of Truvada, the original one, like are what we already talked about with the bone density and then the kidney problems.
Yeah,
And then there are short-term side effects, like which affect them for like the first couple of weeks.
yeah,
And those are, like, mostly, like, GI upset, so, like, nausea, some vomiting, some diarrhea, some abdominal pain.
right.
But those kind of go away within the first couple of weeks.
Mhm.
But in general, the side effects are very minimal.
Yeah.
Most people, if they experience any of that diarrhea, upset stomach, it goes away, and then most people whenever they come back every 3 months to get a refill of their, PrEP medicine, you have to test their kidney function again to make sure that their kidney is okay, and if their
Mhm.
kidney starts to take a hit, then you can either reduce the dosage or you can just take them off the medicine. Um
I mean, this is a game changer with or without these side effects. It's attacking the problem. It's getting it's taking HIV and AIDS head on, and um like you said, it's the statistics are going down on infections in the US and worldwide. I feel personally that this is something that needs to be taken to fight this virus basically, because it's been with us way too long. We've lost way too many people. Um,
Yeah, and the newer version of PrEP, Descovy, that's the TAF version that you were talking about in the
yep.
Forbes article. That's the newer version, and it does not have those side effects.
No,
It
great.
doesn't have the bone loss, the bone density loss, or the kidney like impact.
Mhm.
So that, but it does have different side effects.
Right.
It's associated with a little bit of weight gain and a
Mhm.
little bit of an uptick in your cholesterol.
Now there isn't any medicine or pill there with no side effects, right? Everything has side effects.
There's very few that have no. I mean, a few. Yes, in general, almost any medicine has side
Even
effects.
antibiotics have side effects, really.
Oh, those have big side effects.
Yeah.
Yeah. Those have big ones. Yeah.
Yeah.
Like bigger than HIV, or
Yeah.
bigger, sorry, bigger than PrEP. Yeah, bigger than the PrEP side effects.
Yeah. So, but statistically, it's and in general for the population, I feel like it is worth it. It will
Oh,
protect you.
yeah.
I
I think
I
I think
encourage
so.
condom use, because, even though you still get checked, some people can get off PrEP and then decide not to go their last appointment, and they
Mhm.
have syphilis or they have gonorrhea, and they start, you know, going into the community, and it just spreads. It spreads like wildfire.
Mhm.
Um,
Yeah.
and these are issues that we don't want to have. I mean, you don't want to have sex and get syphilis. I mean, it's like a this is like a medieval kind of disease, right?
I know, like the kings of old, who
Yeah.
went
It's like,
crazy from
geez,
it.
now it's coming back.
Yeah. I know it's a resurgence. Like when I went to med school in Florida and there was a ton of syphilis
Oh
when
man.
I was there.
Oh, it's Florida.
So
I'm just
yeah, it's Florida. I know they have all the problems.
kidding.
But I just looked it up actually. So Truvada, the initial formulary came out in 2004,
Okay.
and then Discovery came out in 2016.
Okay.
Um, so I think Discovery is probably going to be the better choice going forward.
Is Truvada
Right now,
even sold? Is the old version still on the market?
yes, it is, and it's actually still the recommended first choice.
Really?
Just because it has been studied so much more than Descovy, it has an extra 12 years of research and clinical trials behind it. So unless someone has kidney problems,
Right.
the first choice is still to prescribe them Truvada.
Mhm.
Um, and especially since most of the people who are on PrEP are young, bone density loss is not really that much of a problem in a younger population,
But
like,
we
and
are the aging
especially in
queen
men.
for most of
I
us.
know,
We
I know,
are
you're
we're in
the
40s
aging
up.
queen.
Yeah. So for
Um,
people who are 40 and up, I mean,
I would still follow the recommendation,
right.
and say that unless they have kidney problems, to start them on Truvada,
Mhm.
and and that once Descovy has a few more years of research under its belt,
Yeah.
and once it becomes the preferred option, then I would switch them over. But you could be switching them over to a medicine that has a different side effect, like
Right.
that just hasn't been discovered yet.
Yeah, there's no
So it's
perfect
almost like,
world. Yeah, or come
yeah, like the better the devil you know in
exactly.
this in this in this sense. So I would just go with the guidelines, start them on Truvada, again, unless they have kidney problems, and then just switch them off in the future to Descovy if, once that's been studied more. It's still a very new drug, and so,
Yeah.
it's better to wait.
I think it scares some people because it is a new drug. It hasn't been around for 20, 30 years. And even though statistically it's working, you just don't know what it's doing to your insides, for instance. Um, so I would say, listen to your doctor and do some research on your own. And even if you do take it, I think let's just use as much protection as possible. Get all these diseases out of our community. And if you wear a
Mhm.
condom and you're on PrEP, you're much more um in line with keeping safe, and if not just you, but your partner.
Yeah, yeah. I mean, like, I know a few people who have HIV,
Mhm.
patients, and they're always, obviously it's life changing,
Yep.
and so there are treatments now, as you know, to prevent HIV from going to full blown AIDS, and people's life expectancy, if even if they have HIV, is the same now as if they didn't, as long as they are on the daily treatment medicine.
Mhm.
So HIV is not, it's no longer a death sentence,
Right.
but it is, it does require, um, it is something that, uh, stays with you forever. So
Yep.
yes, I agree with you. Like using PrEP.
Yeah.
So using PrEP is a very good idea.
I also think using protection is a great idea.
Yes, and
Um,
condoms. Absolutely.
yeah,
Yeah.
I think people have gotten a false sense of security or really don't put too much care or attention into the other stuff, but the other stuff is just as bad. I mean, you really don't wanna be going to the doctors every month to take pills, and sometimes these antibiotics just don't work, right? There are resistant patients that are
Mhm.
resistant to antibiotics.
Yes, there are. There are,
Syphilis, for instance, is becoming pretty resistant to a lot of them, right?
yeah, yeah, it's called, like, the arms race. Like, we develop antibiotics, and then the bugs, the bacteria,
Mhm.
develop defensive mechanisms against
Wow.
our antibiotics, and then we develop stronger antibiotics, and then they develop stronger defensive mechanisms. So it's like the
It's
the
a
the
war.
arms race.
Yeah.
Yeah, it really
Ongoing
is.
war.
Yeah. So definitely, like, and there are chlamydia and gonorrhea strains that are more resistant to antibiotics, and you have to, use the bigger guns, which you really want to reserve for other things in the future. If you're in the ICU with pneumonia, you really that's when you want to use the bigger guns. You don't want to
Right.
use them, for a simple chlamydia infection, because then later on you may have resistance to those bigger guns.
Huh. Interesting. Wow. Well, you have enlightened us for sure. And thank you for clarifying, doing all this research also, and just being wonderful, Dr. Kristen.
Aw, thanks, Lewis. You're so
Yeah,
sweet. And
thank
thank you for inviting me to be on your show. I've never been on a podcast before, so this
Oh,
was a big
really?
deal for me. Never. Nope. So thank you.
Well, you're welcome to come on anytime. We hope you're a regular.
Ah,
And you can be our Dr. Kristen on the show. Yeah, you're just brilliant. Um,
oh, well, thank you. But I will be a guest on your show anytime.
yeah, and we can also talk about light stuff. It
Yeah, exactly.
doesn't also
It
have
doesn't
to.
always have to be medicine. Yeah.
Yeah, yeah, we're gonna be talking about a lot of cool stuff in coming up episodes. I just want to get these conversations going on the important topics
Yeah.
and to
I
clarify
agree.
things because I think also out there's a lot of doubt and kind of gray zone on things like this. For instance, you've helped us clarify things. Um, well, we will talk soon when you come on our next episode. I want to thank our listeners and please protect yourselves, stay safe out there. And thank you, Dr. Kristen, for coming on the show again. We'll speak again soon.
Absolutely. Sounds good, my friend.
Thank you. Bye bye. Just want to add the information provided on this podcast are opinions and are for educational and entertainment purposes only and does not constitute professional medical advice. Consult a medical professional or healthcare provider to seek medical advice, diagnoses, or treatment.